Hello, my name is Raven. I will be acting as the occupational health representative, and I will be teaching a fellow coworker about AHS protocol when it comes to needle stick injury. Ouch. Randy, are you okay?
I'm okay, it's just a small poke.
No, it's not just a small poke, Randy. It's a needle stick injury and it can have serious consequences. I think it's necessary that you report it to AHS protocol.
Needle stick injuries? Serious consequences? What is the AHS protocol?
Here's some more information.
Needle stick injuries are wounds caused by needles that accidentally puncture the skin. They are hazardous for people who work with hypodermic syringes and other needle equipment. These injuries can occur at any time when nurses use, disassemble, or dispose of needles. When not disposed of properly, needles can become concealed in linen or garbage and injure other workers who encounter them unexpectedly. Sharps include needles as well as items such as scalpels, lancets, razor blades, scissors, spikes, metal wire, retractors, clamps, pins, staples, cutters, and glass items. Essentially, any object that is able to cut the skin can be considered a sharp. Needle stick and sharp injuries are hazardous because they have potential to transmit infectious diseases, especially blood-borne viruses. Of most concern include HIV, hepatitis B, and hepatitis C. Accidental punctures, contaminated needles can inject hazardous fluids into the body through the skin. There is potential for injection of hazardous drugs, but contact with infectious fluids, especially blood, is by far the greatest concern. Even a small amount of infectious fluid can spread certain diseases effectively. Sharps can create a cut in the skin which allows contact between blood or fluids. The risk of infection after exposure to infected blood varies by blood-borne pathogens. The World Health Organization reports that of 35 million healthcare workers, 2 million experience percutaneous exposure to infectious diseases each year. It further notes that 37.6% of hepatitis B, 39% of hepatitis C, and 4.4% of HIV and AIDS in healthcare workers around the world are due to needle stick injuries. Needle stick injuries have transmitted many other diseases involving viruses, bacteria, fungi, and other microorganisms to healthcare workers. Needle stick and sharp injuries have serious consequences.
Injuries can occur at every stage of their use, disassembly or disposal. The percentage of injuries that occur at each stage are as follows. During or after disposal, 22%, after use before disposal, 19%, and during use is 52%. Equipment design, nature of the procedure, condition of work, staff experiencing, recapping, and disposal and exhaustion have all been mentioned as factors that influence these occurrences. Preventing injuries is the most effective way to protect workers. Injury prevention includes recommended guidelines, improved equipment design, effective disposal systems, employee training, safe recapping procedures, and surveillance programs. Preventing injuries from sharps and needle sticks is considered a part of the routine practices used by healthcare workers. Workers who use sharps require education and training as a part of sharps injury prevention program. Workers should be educated in how to protect themselves during use and to protect others who may encounter the device during or after procedures. An effective system for disposing sharps and needles is crucial to preventing injuries. Have disposal containers readily available. Workers should place needles in wide-mouth, puncture-proofed containers. Locate disposable containers specifically where needles and sharps are used to make safe disposal possible. Replace the containers before they are completely filled. Sharps containers should be removed and replaced when they are 3/4 full. Make sure they are sealed, collected, and disposed of in accordance with local regulations for biomedical waste. All staff should report every incident in which they find needles or sharps left at bedside or thrown into the regular garbage.
Now we are going to discuss the AHS protocol for Mandatory Testing and Disclosure Act post-exposure management and prophylaxis of HIV, Hep B, and Hep C. Body sites that have been exposed should be cleansed immediately after a potentially dangerously infectious fluid. The site should be washed with soap and water. Avoid alcohol, hydrogen peroxide, bleach, or other chemical cleansers. Antiseptics, disinfectants should also be avoided. Do not squeeze the wound. This may promote hyperemesia and inflammation. You may also run the risk of contracting HIV. Allow the wound site to bleed freely and lightly cover. Exposure to mucous membranes, like the eyes, should be flushed with water or normal saline. The pathogenesis of early HIV infection. It can take several days for infection to be present in lymphoid and other tissues. In this moment, intervention is very crucial. It can prevent the exposure from becoming an established infection. Within 1 to 3 days, the virus remains at the site of the needle poke and the surrounding lymph nodes. Within 10 hours, the virus can double in quantity. So, within 48 hours, 1.3 million cells are infected with HIV. The earlier that PEP can be initiated, the less infected cells will exist, and a higher likelihood of successful protection is possible. PEP stands for post-exposure prophylaxis. This can prevent life and health. The only way to reduce the risk of getting HIV when exposed to the virus. PEP has been established as a standard of care in Alberta, and no evidence to support change to the standard of care is present. PEP should be started ASAP, within 1 to 4 hours upon exposure, and no longer than 72 hours, because the efficacy declines rapidly with time. The PEP's duration lasts for about 28 days. Hepatitis B virus. The transmission is 8.6 times the risk of getting HIV when exposed to the virus. Hepatitis C virus. There is no effective or recommended PEP against HCV. 40 to 50% of symptomatic patients will spontaneously clear the virus by 3 months, but asymptomatic patients are less likely to clear the virus, so early treatment is recommended. And there is research for future prevention. Research for future prevention. Determining the rate of injuries, investigating the factors that cause the injuries, ensuring that injured workers receive proper treatment.
Identifying areas in which the prevention program needs improvement, leading to practical strategies for dealing with the problem.
You know, out of everything you do, this is the most dangerous thing. So as you're preparing to give an injection, or after you've given an injection or started an IV, you should be on alert until you safely dispose of that hazardous substance. And I think one of the problems is because you're dealing with it all the time, you become nonchalant about it. You become, you know, this is something I do all the time. Or you go through so many days without having a needle stick, you begin to think you're above it.
Very, very important to make sure that we are helping the staff, that they're not getting introduced to any pathogens from patients. So I want to take this pledge to ensure that we can have a nationwide force to make sure that we're providing the adequate tools in the clinical setting.
Unfortunately, somebody didn't empty the Needlestick boxes, and so I reached down to put a needle in the box, and the needle was sticking out, and so I stuck myself. I mean, it was scary, and I just didn't know what was going to happen. I didn't know whose needle it was, and I was terrified.
I would tell you about my most recent story, where I was in the operating room and I was closing a wound. It was a cervical fusion. And I actually stuck myself when I was closing, and I knew the patient had a past history of IVDA, and I had to go to employee health and be tested, and I actually had to go on the antiviral medication myself for a couple of days, which was completely awful until her testing came back. And I would hate for anyone to have to do that.
Mine, I worked in a prison where we had a lot of hepatitis B positive, C, HIV positive patients. I reached into to get a lancet, and somebody had replaced it. One that had already been used, threw it in the wrong container, and I got stuck. So I had to go through testing for several years, and I still get tested just to make sure that there isn't a problem.
Yes, I did have a needlestick story. When I was a nurse in the ICU, long time, years ago, I did stick myself with the needle. Thank God, I have to follow for an year for hepatitis and HIV. Thank God the patient did not have any of those diseases, so it scared me.
I think that the needle stick is an issue that you forget about until you pull out the needle, and then you get to talking, and it's something that is always in your mind.